everybody. This is Joe Freudenberger with Oak Bend Medical Center in Richmond, Texas. We are celebrating Physicians Week this week. I'm joined by Dr. Tracy Stammann. She is family practitioner, otherwise known in the olden days as a general practitioner, and she treats all ages, from kids up to seniors. And there are a few things that you've seen in your practice over the years that you've been in practice that not all of us probably know. And I'm hoping you can give us a little bit of an insight, because as I've learned, as I've gotten older, the things I don't know can literally kill me. So I need to become educated. So if you can share a little bit about sort of things that we need to know in deciding whether to see a doctor or not.
Of course. Thank you so much. It's wonderful to meet everyone. I'm so happy to get to be here with you, Joe. I'd love to answer that question.
Okay.
So when it comes to being a family medicine doctor, I pretty much see anything and everything that comes in through the door. Anytime someone comes in and says, what's this rash? What's this medicine I'm supposed to take? I'm here to answer those questions. When it comes to what I need the general audience to know, let's talk about high blood pressure, diabetes, and then any chronic condition that you're supposed to take your medicine daily to help manage. What I mean by that is that let's focus on blood pressure first. Normally that's called the silent killer for a reason. You do not know you have high blood pressure because you don't feel it until something bad is about to happen. I'll explain on that in just a minute. What happens with high blood pressure? It's putting more strain on your heart because your heart's trying to beat to get the blood to circulate. It's trying to help you live, but it's working harder. It's a good thing and bad thing. Good thing because your heart's still flexible. Bad thing, it's working too hard for a particular reason.
So you're wearing out your heart with high blood pressure.
Correct. Think of like a car and its tires. If you drive more, you put more wear and tear on those tires. Except, unlike your tires, you can't really replace your heart.
Yes.
So we manage that by having you come see me in the clinic. That's what we do by checking your blood pressure and giving you just a quick check over, also known as your annual physical. That's where we can check your blood pressure, get some basic blood work done, and then do an evaluation. This lets me exactly see how you're doing, and then we can have a discussion over it. So while on the topic of blood pressure, there's certain ranges we need everyone to be at, but it can vary based on age and gender, of course. Normal blood pressure is specifically 120/80, but depending on the person's body size, their height, their weight, their gender, that can fluctuate a little bit. And then if we start to notice it increases, risk factors that could cause it to increase could be, again, your age, could be you use tobacco products, you drink a little too much alcohol, or your BMI, also known as your weight, could be increasing too much. All of that could increase your blood pressure beyond what the normal ranges are. So what are abnormal ranges? That could be 140, that could be 150. That's the top number, known as systolic. Diastolic, it could be 80 or 90 or even 100. That's when we start to get into the topic of discussion. What I mean by that, by discussion, we're a partner. My patients and I, we talk about things. My job is not to go, here's a pill, take this and get out the door. My job is to help educate, to explain why we need to consider maybe this medicine, or maybe lifestyle choices, like cut back on tobacco use, cut back on alcohol use, or diet and exercise. I know those are fairly hard, but my job is to help everyone to get those readings.
So what happens if I don't what happens if I have high blood pressure and it goes untreated?
So that's why it's also known as the silent killer. The goal is that to keep your blood pressure numbers under control. That is the absolute end goal. If I cannot maintain that goal, it puts more and more strain on your heart. It can increase your risk of having heart attacks, strokes, even death. That's what we really got to be careful about.
That's occurred to you in your practice?
It's unfortunately true. I have had a patient who we had to talk about, you need to take your blood pressure medicine because your blood pressure is high. They said, okay. Came back, blood pressure was still high. Came back, their blood pressure was still high. And they admitted I wasn't taking my medicine until finally one day I got a call from his family. Hey, he passed away on the side of the road. He had a heart attack.
Oh, that's terrible. Now, are guys more prone to do that sort of thing than women?
There are actual studies, and I have seen it in real life, where gentlemen tend to be a little bit more hard-headed. Sorry, guys. Where they're a little bit more resistant to taking medicines, to hearing advice. Because I know they're hard workers. They've been told, suck it up. You got to keep working. You got to go to work and provide for your family. That sometimes their own health falls to the wayside. But that's where it comes to us, is that, again, we're partners. We're here to help everybody.
And didn't you say married men tend to live longer than single men?
Yes. Again, literature has proven that there are studies that show married men live longer. They have that partner, they have that spouse, they have their wife who helps them. Take your medicine, dear. Let's go see your doctor, dear. It's time for your appointment, dear.
Okay. Well, my wife certainly gets on me when I don't take care of my health. Are there other chronic conditions that sometimes go unrecognized, that have long-term bad implications?
Of course, surprisingly, diabetes is on that list as well.
Okay.
Sometimes diabetes can have obvious signs unlike high blood pressure. What I mean by that is that if someone's sugar starts to increase and they don't notice it, their body tries to help that. They might be more thirsty than average. Let's say if you're in the office where there's air conditioning, you're reaching for that cup of water a little bit more than you think you should. Or you're having to get up to go to the bathroom to void your bladder a little bit more than you think you should. That is your body's way of trying to help dilute that sugar to get it out of your system.
Oh.
We can investigate that with a simple blood test. Rule that out, or again, those risk factors. Gender, tobacco, alcohol use, elevated weight can increase your risk of developing diabetes.
Got it. All right. And the long-term implications if I don't treat diabetes, what happens?
That's actually worse than the high blood pressure, in my personal opinion. That can start to affect your nerves, could start to cause toe and feet tingling, where you feel like those fire ants are biting you, but it's coming from the inside. That can be managed by medicines or keeping your sugars under control, because believe it or not, sugar is an irritant. It scratches at the nerves on the inside.
Really?
So it causes inflammation, hence why you might have that neuropathy feeling is what we tend to call it in the medical terminology. Then again, nerves are now damaged. Sometimes people with diabetes are barefoot outside. It's great. This is Texas. We love going outside. They get an injury and they don't know it. So their chance of developing infections are a lot higher than the average person, because everyone, look at your feet. How often do you look at the bottom of your feet? Diabetics don't know they have an injury, so that's how it can go missed.
Oh boy. And my recollection is diabetes also causes harm to all sorts of other organs in the body. I mean, and that folks with diabetes have higher incidence of heart disease, cancer. There's a whole host of things that spin off of diabetes. Is that right?
You are 100% correct.
Okay.
When someone knows they're a diabetic, each year when they come in for their annual physical, we have to double check when was their last diabetic eye exam, because your eyes have very delicate nerves. Again, nerves and sugar. If the sugar becomes too high, they tend to irritate those vision, and someone could have vision problems.
Okay.
Heart as well. Heart is related to everything, and if there's a chance someone's diabetic and they're poorly uncontrolled, it does put more wear and tear on the heart. It does increase chance of clogged arteries. Atherosclerosis is what we tend to call that one in the medical terminology, and again, it increases your chance of having that heart attack.
Okay. So two big categories of disease that we can prevent or we can mitigate, manage, if we come in to see our doctor and we follow the doctor's guidance on what we should do to treat it.
Correct. Is that I as a physician like to word team player, is that we're not here to tell you take a medicine and leave. We're here to talk about your different options. So our goal is talking about, if we start to see something, let's talk about how we can either mitigate it, improve it, or completely resolve it.
Okay. Let's switch gears and let's talk briefly about our Family Medicine Residency Program.
Oh, yes.
You are the Residency Program Director. So tell us a little bit about what a program like this is intended to do, and what makes our program something that you're proud of.
So what our goal for the program is that we want to help the members of Fort Bend County and beyond. We really want to focus on the suburban, the rural, and the extended communities, because I was actually born and raised here. I'm not sure if you know this, but your Jackson Street location, I was born there.
Really? I did not know that.
So I've been here almost all my life, except for my education for medical school and residency. And my ultimate goal was to come back here because there's friends, there's family, there's neighbors. I know this population and I want to do my best to be able to give back, hence the residency program.
Okay.
I know the populations, I know their needs, I've lived it, I've breathed it, and I'm still here.
So let me interrupt real quick. A residency program is a program to train doctors, because they have their medical license when they come out of their training, right? Their education. But a residency is, tell me more. What's the difference between going to medical school and residency?
Great, that's a great question. Medical school is where you literally do college all over again for 2 years. That's your hard sciences, your organic chemistry, your anatomy. Then the 2 additional years after that, that's when you're actually on rotation, is what we call it. You get to hang out with a cardiologist for a month, a family practitioner for a month, a general surgeon for a month, and then some specialties like pulmonology, derm, and it keeps going. When you graduate medical school, now you choose what you're going to be for the rest of your life. Family doctor like me, a general surgeon like some of our surgeons here at the office, or even a cardiologist. That is your specific training on how to do that job for the rest of your life. Some of the residency programs are 3 years, like family medicine. General surgery is 5 years. Neurosurgery can be 7 years.
So basically, as a resident, you're practicing your specialty under the supervision of a physician in that specialty.
Correct.
Whereas when you're in medical school, you're learning the basics. You're not learning how to be a cardiologist or a family doctor. You're learning how to be you're learning the basics of any doctor requires. Correct?
That's 100% correct.
Okay, cool. All right, so we give back. The residency program gives back. Is there anything specific about our family medicine residency program that residency programs, you've been to another one, that you think is a distinguishing characteristic that people should consider when thinking about residency programs?
We're training for the next generation. Is that I've heard it time and time again, my favorite doctor is going to retire soon. That's our goal. We want to help replenish. We know Fort Bend County is a growing community. It's a growing population. We want to encourage more doctors to live here, to come here, to help see more patients so they can get the care they deserve. Because we know what the population needs. We know how to train for it. We know this is Texas. We're polite, we're respectful. We want to help encourage that so our future residents can help take over some of those patients and get them the care that they need.
So what I'm hearing is that if you have an interest in a more suburban community, such as where we are located, a residency program located in that community is your best path into the community on a permanent basis.
That's
Am
correct.
I summarizing that?
It helps get your foot in the door so that you can start to get involved in the community.
Gotcha. Okay. Well, this has been great. Thank you so much for joining us, Dr. Stammann. I really enjoyed the conversation and the education, and I've become fascinated by the things I'm learning here on Cup of Joe. And thank you all for joining us. It is Physicians Week, and we're celebrating our amazing physicians. So help me and join me in expressing our appreciation for them. Thank you. See you another time.